Hello, my name is Brian Wesley Johnson, and I'm the founder and CEO of Soulivity.com. We've created an ongoing special editorial features section called Bridging the Gap, which is dedicated to addressing lack of health access and equity facing the majority of Americans. This is a special editorial commitment from us, which is also part of a growing discussion which focuses on challenges and solutions facing communities across the United States. Soulivity spotlights widely known health inequities, the critical importance of broadening health research, valuable guidance and insights from renowned health professionals, and the accredited resources necessary to empower and mobilize our highly connected, socially active audiences. Today, we focus on prostate cancer awareness, which is affecting many men across minority communities. In fact, prostate cancer is the second leading cause of cancer death in men in the United States, behind lung cancer and colorectal cancer. And within the African American community, prostate cancer awareness is exceedingly important. For with Black men, 1 in 6 will develop prostate cancer and are more than twice as likely to die from the disease. And every year, thousands of men are diagnosed with prostate cancer. And though we know that early detection is a key to successful treatment, unfortunately, many men don't have the information they need. So, joining us today is my guest, Dr. Tewari, who's the chairman of the Milton and Carroll Petrie Department of Urology at Mount Sinai Hospital in New York City. As director of the Department of Urology, he leads a multidisciplinary team committed to improving prostate cancer treatment, research, and education. And I thank you, Dr. Tewari, for being here. I think we're going to have a great discussion, a frank discussion about prostate cancer, something that many men find difficult to talk about. I mean, we want to break down those barriers and empower men to take control of their health. So I thank you again for being here.
You're very welcome, and I think you summed it up. Let's talk about it.
Absolutely, absolutely. So my first question to you, Dr. Tewari, is why is prostate cancer awareness so important, especially for men who may feel healthy and have no symptoms at all?
I think that's the key here, that this cancer, which is very common, is very connivable. It produces no symptoms in an early part of its journey, and that is the time when it is potentially curable. So, if we really want to find this cancer when it is curable, we have to look for it. And that's where the early detection is an important feature, because by the time cancer travels to the lymph nodes, to the surrounding structures, to the bones, we have kind of defeated ourselves in our ability to win this cancer. So, if we want to win, we have to start early before the animal has become very big.
Absolutely. Sounds like a plan to me. What are some of the biggest misconceptions about prostate cancer that you encounter? And how do those misconceptions impact men's health?
I think the one of the most important one is that it happens in someone else.
Mm.
Now, it happens to almost 1 in 6, 1 in 7, 1 in 8 men in United States. And as you mentioned, 1 in 6 Black men will get this cancer. So being prepared or being cautious is a great idea. Second misconception is that I don't have any symptoms. It cannot happen to me. Now,
Hmm.
there will be no symptom, and actually, we'll have to go out looking for this cancer. These are the two most important things. And then the third misconception is that nothing can be done to preserve sexual function, even in an early cancer. Now, it's possible to do a lot of things, a lot of technologies, a lot of techniques have been developed to help in that part of the journey. But it all starts with finding a cancer early before it has become potentially a problematic cancer.
Thank you for that. Now, what are some of the most significant risk factors for prostate cancer? And are there any lifestyle changes men can make to reduce their risk?
So the risk factor, the one of the most important risk factor is being a man. Second most important factor is aging. Third most important factor is in family history of prostate cancer. Next one is being from a black race. Then certain chemical exposures. Then someone whose family has in breast cancer, someone whose family had the pancreatic or the kidney cancers. These are the clusters which make it little bit highly likelihood of developing prostate cancer, but it can happen to someone who can be as normal as it can be, but still has a 1 in 9, 1 in 8 chance of developing prostate cancer.
Wow. Wow. Now, does family history impact a man's risk of prostate cancer? And what should men
Absolutely, it
with a
does.
family history, yeah, what do they do about screening and prevention when it comes to that?
I think the discussion about screening and early detection in prostate cancer is a discussion about what we call a shared decision making. Meaning, we need to educate the patients that what is their unique risk of developing prostate cancer. It's not what is an average risk for everyone else. We have to uniquely zoom it down to that individual just because the person is of 78 years of age or per person is of 56 years of age. Their risks are different. Person of an Caucasian background versus a black man will have a different kind of an risk assessment. Patients whose three brother had a prostate cancer versus person who doesn't have any family history will have a different risk. So that's the reason in a normal person we started at about 49, 50 years of age, but we start earlier amongst people who have a high family history or who are from the black ancestry.
Wow, thank you. Now, beyond PSA testing, which is widely used, what other screening tools or advancements are on the horizon for prostate cancer detection?
So I think it still starts with the blood test, that is the PSA. We call
Mhm.
it prostate specific antigen. I also call it PSA means please stay alert. Basically, if you are thinking about it, there is a more likelihood that you will find the cancer early. But if you are not thinking about it, that's when it strikes out of the left flank. So we just need to focus on one test, that is the blood test known as a PSA. But what happens after the first blood test? There are many biomarkers, many imaging, many ultrasounds, many kind of scans which can be done. But usually starts within PSA, and then you can look into the PSA in many different ways. You can look at the PSA for a particular age, and we call it age specific PSA. You can look at the PSA as to how big is the prostate and what amount of PSA is being produced. We call it PSA density. Bigger prostates may produce a little bit more PSA, but it still may be normal. Then we look at the PSA over time. We call it delta PSA or PSA doubling, or more simplistically, PSA velocity. All that forms a PSA algorithm, which we try to tailor it to in particular individual, because there are reasons above and beyond cancer which can elevate immense PSA, and we need to be aware of it. And that's exactly what needs to be told to the patient, that you know what, not every elevated PSA means cancer, not every cancer needs a treatment, not everyone has the same kind of a treatment. So shared decision making and asking about the pros and cons of this approach towards finding the cancer is a very important part of our discussion. You were asking about what other biomarkers are available. Nowadays, almost everyone who has an elevated PSA has an option to look at different kinds of an imaging, and one of them is an ultrasound, one of them is an MRI. Many a times we do in multi-parametric MRI, 3 Tesla multi-parametric MRI, in which we get to see some things inside the prostate. And sometimes MRIs are totally normal. And sometimes they show a lesion, what we call in parad scoring. And if it is 3, 4, or 5, we start getting a little bit more cautious and we start looking for a cancer. We have different kinds of blood tests, different kinds of PSAs. One of them is known as a 4K test. One of them is known as in different kinds of a free versus complex PSA. We have markers in the urine. We call it EXO or we call it select MDX. These are the markers which can be seen in the urine and it still can tell us about whether there is a risk of prostate cancer or not. Obviously, sometimes we need a physical exam to check out if the prostate is feeling abnormal or normal, but that is down the stream. I really think patients or men who are thinking about the risk of prostate cancer, they should have a conversation with one of the urologist, one of the doctors, in a form that they need to understand their individual risk of prostate cancer, what next first test they can do it, and if that test is little bit borderline, what next step could be. And there is an half an hour discussion we can have as to how to interpret PSA and how to proceed afterwards. But field is evolving a lot. Imaging has made an impact. Genomic is really driving its own biology and the discussions. And we have a very exciting years ahead of us in terms of prostate cancer detection.
Wow. Wow. Amazing. Amazing. Now, I'm sure that people are interested in if there is a detection of prostate cancer, what are the most common treatments for prostate cancer?
I think before, that's a great question, but before coming to the treatment part of the discussion, maybe we should talk about it. What happens if there is indeed an abnormality in one of the blood tests or one of the urinary
Hmm.
tests? Because
Hmm.
you can do it different kinds of biopsies also for patients with prostate cancer risk. And these are known as transperineal biopsy, transrectal biopsy, or MRI guided fusion biopsy. These are the nuances which are coming up, and I think average person needs to be aware. There are more than one ways of getting to know if they have a cancer, if they have an abnormal blood level. And these things can be streamlined. Sometimes they can be done in an IV sedation so that they don't have to feel too much. But there are many options available. So one aspect is to get the biopsy done, and that's one test. Then comes you had a biopsy. Biopsy shows some cancer. What to do with that some cancer discussion? The next thing we need to know is what kind of a cancer. Not every prostate cancer is the same cancer. Some
Hmm.
cancers are very
Hmm.
indolent. These cancers are not going to grow fast and they can be really
Sure.
observed for a long time. Then there are
Mm.
cancers which we call an intermediate risk prostate cancers, which usually need a treatment but potentially can be observed also. And then there are
Mm.
aggressive ones in which we talk about surgery or radiation or combination of hormones and chemotherapies and other modalities. Depending upon the patient's life expectancy, patient's
Mhm.
grade of the cancer, patient's location of the cancer, patient's confinement of the cancer within the prostate or outside, whether or not the lymph nodes are involved or not, if it has gone to the bones, there are many different ways of treating it, and one of them is in watchful waiting or an active surveillance, other what we call a focal therapy, and then there are robotic radical prostatectomy, nerve sparing procedures, or different kinds of radiation, all that combined sometimes with or without the hormonal treatment. So we have a lot of treatments available. We just need to match the right treatment for the right patient. And that is where the art of prostate cancer treatment starts.
Gotcha. Gotcha. And it makes sense. It makes a lot of sense. Um, if if are there any new or emerging treatments emerging out into the future when it comes to prostate cancer that's offers additional hope for improved outcomes and fewer side effects?
So I think the focal therapy and different kinds of focal therapy are an important addition to our tools. Developing techniques of nerve sparing and how we are using hydrodissection to save the nerves within water jet and removing the cancer away from the that is an important milestone. Developing techniques that minimizes the sexual function and the urinary control issues, different kinds of radiation in which we can avoid damage to the surrounding structures, including the rectum or the bladder, injecting something between the prostate and the rectum so that there is a gap and there is some space so that the radiation doesn't have to travel through the surrounding structures. And the newer kind of treatments are coming out. We have many clinical trials going on and drugs with lesser side effects. Even the immune mechanism drugs are being tried now for the prostate cancer. So you were right. Many more drugs, many more treatments, many more minimally invasive approaches are coming out for prostate cancer treatment. All starts with finding the cancer early, and all starts with the risk assessment and kind of standardizing as to what kind of a cancer we are dealing with it. One will need just minimal zapping, another will need
Mhm.
every combination of treatment. That's what we need to find out.
Excellent, excellent, excellent. And what advice would you give to men who've been diagnosed with prostate cancer, both in terms of their medical care and their emotional well-being?
I'll address this, but I don't want to forget about your lifestyle intervention discussion, which you had asked me a little early on.
Mm-hmm.
So my advice to men with prostate cancer is don't worry. There is a lot happening which can help you in beating this cancer. Majority of men, we win. There are techniques being developed to minimize the side effects. There are approaches which will treat the cancer, yet you can retain the sexuality or the urinary control function. But do get yourself tested a little early. And think about there are two other aspects of prostate cancer treatment, and one of them is an eating right, another is an exercising. Both contribute to the well-being. Less red meat, less animal fat, less sugar, possibly more lean protein, eating from all the colors of the rainbows, some blueberries, some mushrooms. I think that's a good idea. And exercising and managing your weight is a good idea because there is a data suggesting that people who kind of have a metabolic syndrome and other comorbidities and diabetes, they may have a different interaction with the medications and the treatment which we offer for prostate cancer. And if we want to beat this cancer in a holistic way, definitely exercise and diet has an impact. And not to forget that stress, mindset, relaxation has an impact on prostate cancer because prostate cancer does become a little bit more angry if person is
Mm-hmm.
going through a lifelong stress. So managing the stress is not a bad idea.
It's interesting that many of the things that you're talking about, I hear pretty consistently across other diseases and illnesses as well. So I think people need to be taking that in and really taking heed to what you're saying around diet, exercise, and other things around managing their stress. Just one more question for you, doctor, before we wrap up here. What's the most important message that you want to leave our audience with when it comes to prostate cancer and prostate cancer awareness?
Prostate cancer is a real problem. Prostate cancer doesn't happen to an individual, it happens to the family. That they deal with the consequences together as a group, as a couple, as a family. There are many advances happening in the medical field which will help them. So the knowledge is the power. And I'm trying to create a digital profile in which we can increase the awareness about the prostate cancer by just telling them individually as to what is their risk of prostate cancer so that they can take it to the next level. Lifestyle has an impact, exercise has an impact, reducing stress has an impact. And my simplified version is 3 miles a day, keep doctors away.
Thank you so much. So much incredible information for this discussion. Dr. Tewari, thank you so much for being with us today.
You're very welcome. Thanks a lot. Bye-bye.
Absolutely. And viewers, we hope that this information empowers you to prioritize your prostate health. Get informed, get screened, and get the support you need. It's also important to remember that prostate cancer is treatable, and there's ongoing research leading to even better outcomes in the future. So there's hope, and knowledge is power.